Welcome to the Doctor's Debrief podcast, presented by NDMD Productions and hosted by me, Vivian McCool, first-year medical student. Here on Doctor's Debrief, we're going to take a dive into some of the most impactful patient cases of a physician's career, the ones that are forever imprinted in their memories and have played a crucial role in shaping their identity as a physician. Although all of us have experience with facing and overcoming adversity, we seldom talk about the skills we use or the lessons we learn along the way. That's why, here on Doctor's Debrief, I'm passionate about being transparent about these hardships and the methods we use to overcome them to encourage others to follow their dreams and learn from every step of their journey, regardless of their circumstances. I'm your host, Vivian McCool, first-year medical student. You can find my YouTube channel in the link in the description below. And with that, please help me welcome today's guest. Today's guest is an orthopedic surgeon in Augusta, Georgia. He received his pre-medical education at Louisiana State University before attending medical school at Purdue University. After medical school, he completed his internship and residency in orthopedic surgery at Madigan Army Medical Center before completing his fellowship in spinal reconstructive surgery at Augusta University Health. He is currently the co-director of spine surgery, fellowship, and minimally invasive spine surgery at AU Health. His clinical interests include minimally invasive spine surgery, disc replacement surgery, as well as deformity and complex spine revision surgery. So please help me welcome the one and the only Dr. Uzondu Agochukwu. Dr. Agochukwu, thank you so much for agreeing to join me today. I'm so excited for our interview.
Absolutely. Thanks for having me.
Of course. So about a year and a half ago, I was applying to med school and I was super excited about the idea of coming to MCG. And I would watch this channel that we're being filmed on right now to kind of get a glimpse of it. And I watched your 73 questions interview the day before my med school interview.
Oh, really?
And you were the first MMI person that I had. So I was like, holy crap, I was starstruck. I was like, holy crap, this can't be real, you know?
Yeah.
It was really cool. But with my introduction, is there anything that I missed that might be of interest to the...
No, so I went to Indiana University, IU School of Medicine.
Okay.
But it's IU. It was on the IU PUI campus, but same difference.
Okay.
Same difference.
Okay. Is that kind of like how I go to Augusta, but it's like MCG or like MCG in Augusta?
It was kind of like, so Indiana University, there's like 8 centers, kind of similar to AU, right? We have these centers kind of around the state. But it was on the Indiana University, Purdue University campus.
Okay, following. So it'd be like if I was at Athens or something.
Yeah, exactly.
I got it. Well, that was my mistake.
That's all good.
So I guess to get started with your practice, when I did your 73 questions interview, you kind of touched on why you got into medicine, and I felt like it was a really inspiring story. So I was wondering if you wouldn't mind sharing here what got you into medicine and ultimately why orthopedic surgery?
Okay, yeah, for sure. So, growing up, my mom is Nigerian, right? My parents are not. My parents are from Nigeria. And so in a Nigerian household, you have a couple options. You can be a doctor, right? You can be a lawyer, or you can be an engineer, and that's kind of it, right? And so I have my mother's brothers and sisters, a few of them are physicians, and so
cool.
I kind of always knew that was something I was interested in, but I had other interests. Obviously, I personally thought I was going to play professional basketball or football and prove my parents wrong.
Cool.
Didn't work out that way.
No.
So when I was 15, my older brother was diagnosed with glioblastoma multiforme, GBM. And so during that process of, essentially him receiving care, to include chemotherapy, surgeries. I was with him for all of it, really. I mean, I would go with him to his MRIs. That's when I realized how terrible MRIs are, because they're so loud and kind of,
so intense.
Obnoxious. Yeah, really, really intense. And then I was in a hospital a lot with him. And so, as a kid, it's kind of challenging, right? Because that's really all you know, and you don't really understand what's happening. But I felt like the doctors did just such a good job of identifying me. They would bring me video games. And so ultimately my brother died of brain cancer, but I think that experience for me was just so impactful. And so I think in that moment I was like, well, I want to, and also realizing that I really couldn't, do anything for him in that moment, right? Because I was a kid. And so I decided that I wanted to go into medicine to really impact people in that way. And so that was my goal, was really to essentially go to medical school, become a hematology oncologist, and take care of cancer patients. And so, for me, med school was amazing, right? Because you get in and you meet all these people, you're learning all this information. And ultimately, I felt like it was kind of leaning me towards my ultimate goal, right? And so once I did my HEMONC rotation as a third year, medicine was my first rotation. And my first, essentially, I didn't do my medicine block first in terms of the rotation. I did HEMONC first.
Okay.
Because in my medical school, it was sort of set up where you could pick an elective. And so I picked HEMONC. So that was my first rotation. And so I walk in, I tell the HEMONC doc, listen, your job is amazing. This is what I want to do. I'm 1,000% sure. And so he sent me in a room with, I think the patient was like 56. He was in there with his wife, their 3 kids, their kids, and his parents. And I had to tell him that he had stage 4 kidney cancer and had like 6 months to live.
What?
Yeah. And so I did it, and they were all super, they were crying. Everyone was super sad. And,
of course.
Yeah. And so I walked out and I got home, and what I told myself what I would do at the end of every rotation, right, was sort of write down pros and cons of that service. Cause I was, other than medicine, other than like HEMONC, I didn't really have an idea of what else I would do, And so my plan was to write pros and cons of every rotation and see what I really liked.
That's a great tip. Yeah.
Right. And so I got home, and it was immediately no. Like HEMONC wasn't something I can do. I think that the profession itself is super noble. I mean, essentially, you're really helping patients die. Because a lot of patients, unfortunately, who have cancer do die, do expire. Granted, the cancer treatments have changed a lot. If you catch it early, there's a lot of optimism in terms of being able to treat those patients. Patients living longer and longer. I take care of a lot of cancer patients who we're seeing kind of live longer and longer. Awesome. But ultimately, I've kind of identified early, like after my brother died, that like I need to, for me to be happy, right? Like that involves living a purpose-driven life, right? And I realized very quickly that wasn't my purpose, And so then kind of going through medical school, I was interested in a few things. My medicine block was first. I was like, I could maybe do peds, maybe I can do this. But then once I got onto my surgery rotation, it was clear that this was it for me.
That was it.
Absolutely. And then I got into orthopedics, and I felt like, in addition to, like, I love anatomy. And so you get to operate really all over the body, especially as a general orthopedic surgeon. And then I felt like the camaraderie that they had in terms of that team environment, me playing sports kind of growing up, it really flowed well. And then I just kind of recalled, my experiences growing up and just thinking like, does this fit with what I like, or is this, can I do this profession to fulfill a purpose that I think I have? And I recalled essentially a couple good friends. One of them, his mom had spinal stenosis. She had a decompression, did great. And another one had a hip fracture, had hip arthritis, got a hip replacement, did phenomenal. And so I was like, for me, selfishly, right? Like in order for me to like be happy and feel like I'm fulfilling my purpose, like that purpose has to be associated with some sort of joy, right? Like I almost feel like, in a way, right? Like we kind of go around life with a basket, right? And I sort of feel like within that basket, like there's a lot of giving, but I need to receive some, to make sure my basket stays somewhat full, right? And so knowing that, like, for me, if people do well, if I can help someone, that just makes me happy, regardless of whether or not they tell me they're happy or tell me they appreciate it. If I know it, that kind of fills my basket as well. And so for me, I knew that orthopedics was it.
That's
sure.
Awesome. So you found your purpose in orthopedics.
Yeah.
Relieving people's stress and pain.
Exactly.
Well, that's a very impactful story. Thank you for sharing. Yeah. I'm really sorry about your brother. I couldn't imagine losing my sister. So I know the role they take in our lives, and I think that the impact he left with you and the change you get to make every single day is a testament to itself. So with his treatment, did you come across any surgeons that might have you thought about during your rotations, or were you kind of just so focused on the HEMONC that you didn't really
Yeah, I think I met his surgeons that kind of took care of him, but I think at that moment I was I was more focused on him, right? And trying to figure out, can we help him? Can I, is he going to survive? Is he going to make it?
What was his name?
Chinadu.
Chinadu. That's awesome. Was he older or younger?
Older. So he was a couple years older.
No, yeah.
And so the thing that, was interesting was like, it's like, in a Nigerian household, right? Like the eldest son is just, there's so many responsibilities that come along with that.
Yeah.
And so, like with him passing, everything kind of changed in terms of like me now sort of being the oldest and kind of having to set a good example, for my siblings and whatnot. And so for me, I think afterwards, it was less about like, the particular doctors and more about like the overall impact that they had on me.
No, for sure. No, that's really impactful. And I guess, at the end of the day, it was one of your options and definitely helped. And wow. Well, rest in peace, Chinadu. Thank you for sharing that story. That's incredible. So right now you work at AU and you're wearing a bunch of hats. You teach residents. You help like medical students like myself if we want to shadow and stuff like that. What brought you into academics?
So I didn't necessarily know that I loved like education and teaching. I think that when you go through residency, it's mostly academic, right? Because you're teach like once I think residents teach residents. You're learning from residents who are above you, and then once you become an upper level resident, you learn from your teaching residents below you. But I didn't really think I wanted to do academics. I thought I just wanted to honestly go out and practice and just kind of, make money and live my life, right? And so I got out into private practice. And initially I had a good time. I lived in Atlanta.
I didn't know that.
So I did my fellowship, moved to Atlanta, was there for a couple of years, and was just doing general spine surgery and some general orthopedics as well.
Cool.
But just kind of realized that it was me and my MA, who she was amazing. But I sort of felt like at the end of the day, if something went great, no one really cared in the room. They were just focused on, let's go, next case. And at that time, I was really sort of coming into my own as a young surgeon. I went to my fellowship was essentially what I would call maximally invasive. My mentor, he's my mentor since 2006. Name's John Devine. He is just an amazing individual, amazing human being. But so I did my fellowship with him. And so when I got in private practice, I sort of realized that there was a need for essentially kind of more minimally invasive kind of techniques. And so I kind of embarked on that mission, and I did that through multiple things. The beautiful thing about the industry is that there's courses all around. There are surgeons that you can go and work with and shadow and to see how to do different techniques, right? And so I was kind of doing that. So I'm doing all these things. I'm getting faster and faster, and I think it's really cool.
Yeah.
But no one seemed to care,
Because it's all about churn and burn.
Churn and burn. And then I realized that also one of the things in that practice was, I got into the place where I was seeing probably I think it was the second most patients in terms of spine surgeons in the practice. But I was doing like the 14th most surgeries because I just felt like a lot of people didn't need surgery,
Okay.
I think that's why spine surgery gets a bad rap, to be honest with you. I think a lot of people don't need surgery. I think, but when you're in private practice, the lines get a little blurred. And so for me, I realized that like that just wasn't doing it for me. I realized that I wanted to be in an environment where I didn't feel like I needed to operate on people.
Right.
And I also feel like I was leaving some sort of impact, like I was impacting someone else.
Yeah.
And I feel like, the interesting thing about surgery is that, we talk about this thing where, in terms of to be good at something, right, you have to talk about 10,000 hours, right? Yep. Do some 10,000 hours. And that kind of, that's how you become an expert at something. Yeah. But for me, for whatever the reason, I've just been really good at surgery and I don't know why, and I feel like explaining it came very naturally to me as well. Like when I go to these meetings and I'm talking to surgeons who are trying to teach me something and I'm like, well, actually, let me explain that a little bit differently. And so I realized that, maybe I'm not living my purpose. And at that time, the interesting thing was, I sort of, I was going through like this weird sort of life transition, right? Like when you go through, college, right? Like if you want to go into medical school and you want to be a doctor, there's always this goal ahead, right? Like you're in high school, you're going to college. You're in college, you're going to medical school. You're in medical school, you go to residency.
Yep.
Residency, you're doing a fellowship. And then once you get to the point where you have your job, you're looking around and like, okay, what else is there? And that's kind of where I was at. I was like, is this it? Can this be it? And the crazy thing was I'm not an anxious person, but I just, in that period of time, like I had a lot of anxiety because I just felt like I wasn't living my purpose.
You weren't filling your basket.
I just wasn't. And so I came down we have this thing that we do every April called the Spine Conference. It's the Augusta Spine Symposium. And so I came down to the Spine Symposium and my mentor was here. I talked to my mentor. I'm like, hey, he's like, how's everything going in Atlanta? I'm like, everything's fine. Like my patient's doing great. I'm getting better and better, but something's just not right. He's like, I think you need to be in academics. I'm like, that sounds like nonsense. I don't want to be in academics.
No.
Y'all don't make enough money, X, Y, and Z.
So much work.
Yeah. And so
much admin.
Exactly. Right. And so, but I realized that in that moment that I wasn't fulfilling my purpose. He was like, listen, just come help me start the fellowship. You just stay here for a couple of years. Cause I wanted to go to LA. I had some buddies in LA. He was like, you can go to LA. I'm like, okay, cool. And so I got here and it was very clear to me that like, this is where I was supposed to be.
That's so cool. You found it.
Yeah, it was, just like that. And so I think the other thing was that, in addition to sort of being in academics and loving the process of like teaching residents, having fellows that I educate, being able to be a part of the process of like accepting medical students, being able to mentor students who want to go to medical school, like all those things, give me so much joy. I don't know why, a part of me, I was talking about this the other day. I was like, sometimes I wish that I like to just do cases and just make money, But, I think that you have to sort of decide, what you find important, right? And I just realized that just wasn't it for me. Like, there's no amount of money that will give me the amount of joy that my current job and other responsibilities give me.
That's amazing. Yeah. Well, it sounds like you're just a natural teacher as well, because you were saying even before you hit those 10,000 hours, you were able to explain things in a way that maybe someone else hadn't thought of.
For sure.
So I wonder if that also plays a part into the filling your basket, the natural, just like it brings you your purpose.
I think so.
It's something you're natural at. And honestly, like I think a lot of the times, especially in college, I had professors who were so smart that they understood things but couldn't explain it well.
Exactly.
And then it left us with troubles, like as students having to learn.
For sure.
So having professors, sure. Yeah. So having professors who kind of can explain things in a different way than Google or other professors, you might be speaking their language. The residents and fellows language is a little more. And
exactly.
That's super important.
Exactly.
And then you're impacting so many more patients that way.
Yeah.
Because instead of just doing your own cases, churning and burning in Atlanta, you're teaching like these 6-10 people who are then going to go treat hundreds of people.
100%.
That's awesome.
When I think of it like this, right? Like ultimately, everyone has a talent, right? We all have a talent.
Yeah.
I just don't think that it's clear to everyone. I initially thought my talent was playing basketball. It wasn't. It just wasn't, But I think through life and kind of continuously sort of seeking my purpose and what I found joy in, I found it. And I think that's it. I think that's the thing. Like you have to seek out the things that you find joy in.
Yeah.
Seek out the things that give you purpose. And I think through that route, it's a little less challenging to find your talent.
I think that's awesome advice, especially for me right now, facing things I think I'm interested in, things I think I'm 1,000% sure of, and trying to keep an open mind and just going to focus on the joy.
That's it. That's it.
So you're in academics now and you love it. Do you see yourself ever leaving? Do you see yourself in LA one day?
I don't.
Really?
No, I don't. It's interesting. I don't know. Whatever. I'm happy to go wherever God leads me. But I think in this period of my life, it's hard to envision anything different. Being where I am now, my daughters love it here. We have a phenomenal community here. My wife's parents live here. So it's just amazing. So growing up, I didn't have my parents, I didn't have my grandparents.
Okay.
And also I felt like, my parents worked a lot. So my mom was a nurse, my dad was a pharmacist. And so my mom was at work a ton. And so now in academics, having residents and fellows, it allows me the opportunity to like be home a little bit more and see them. Being here allows them to like grow up with this amazing village around them. So it's hard to envision anything else.
That's
right now.
awesome. That makes me so happy for you.
Thank you.
Oh,
Thank you.
I feel like you're just such a genuine person, and I'm glad that you get to live this dream. You seem very happy talking about it.
I am. Listen,
I can like feel the joy.
It definitely feels like a dream.
That's awesome.
For
Oh my
sure.
God, I'm so happy for you.
For sure.
Oh my goodness. Okay, so I guess with that, what aspects in orthopedic surgery in specific, other than I guess teaching, do you find most fulfilling and like rewarding?
It's seeing the difference, seeing the outcomes, right? Seeing the difference that you make in patients' lives.
Yeah.
Just yesterday, I did a case on someone who essentially had cervical myelopathy, right? So in the cervical spine, you could develop compression within the cervical spine, secondary to just arthritis and degeneration. Sometimes it's secondary to like a disc herniation. But ultimately, what ends up happening is that you start to develop signs of myelopathy or spinal cord compression. So you lose the ability to really use your hands. You start, you have a hard time with fine dexterity movements. So buttoning buttons, writing, your hands go numb.
Yeah.
You lose your ability to walk because of balance, not necessarily strength, but balance. And so cervical myelopathy, it's like a pretty big spectrum. We usually say about 75% of papers, so 3 out of 4 patients who have it will experience progression. So they'll have this sort of stepwise deterioration where they're doing okay, they get a little worse, then they're okay, then they get a little worse.
Okay.
But and that's 3/4. The other fourth is kind of divided into people who kind of remain stable, and other people who just kind of experience just a spiral downwards. And so this patient had experienced just an acute spiral downwards over the past, couple of weeks. Just aggressive change. And so I decompressed her. And then we go see her this morning, and man, she can walk for the past week. She's walking around the hall. She can feel her hands. She's crying.
Oh.
It's amazing, And so for me, it's that. It's like, seeing patients back in clinic who, you've had this impact on their life. They can go back to doing the things that they want to do. I have another patient who I did this minimally invasive procedure on where he had essentially lumbar disease and some deformity. So I corrected his deformity all through just minimally invasive techniques. So and so then he's probably 6 months out now. He's back to like playing travel softball, playing golf.
That's amazing.
Yeah, so it's that for me. It's the ability to like give people. Not granted, like I'm not going to sit up here and say everyone, after surgery goes back and can run marathons, but I think ultimately, that's why, having a conversation with the patient and trying to realize what their expectations are, I think most of the time you can meet their expectations. And when you do, they're really happy. And so
That's
that
amazing.
for me, that just is.
You really give people their life back, because
Yes.
even though they're alive and they might be able to like eat, drink, like, use the bathroom, that type of stuff, pain and not being able to walk as much as you could or garden and that type of stuff, it takes away from quality of life. And no, you really are doing like God's work by giving them that back.
For sure.
That's awesome.
I never really appreciated how awful nerve pain was until I had a disc herniation in my neck myself.
Really?
Yeah, and had arm pain, and it was the worst. I mean,
Horrible.
I couldn't get comfortable, nothing. Eventually mine was able
And it's
to.
constant.
It's constant, doesn't go away. And I was able to, mine went away with just non-operative treatment, fortunately. But, for patients who experience it and it doesn't go away, I mean, it's dramatic.
No, and
the
going to
change that
see
you
y'all
have.
is scary. No one wants
Yeah.
to see you.
No.
one wants to go
Right,
see you at the
right.
hospital.
The funniest thing to me is like once patients get better and they're doing well, they're like, Doc, listen, I'm so appreciative of what you've done. I hope I never see you again. I'm like, listen, I get it, I understand, but if you do, I'm here. If you do, I'm here.
No, seriously. Okay, so you do a lot to improve people's quality of life, and you spend a lot of time doing it. What do you think the work-life balance is in your career, and how do you, find that balance?
So for me, I think it's being in academics. I don't have to. I'm not as concerned about, how many patients I'm operating on, how many patients I'm seeing, because it is stressful. I think that, sometimes we have this conversation about like, how do you accept, the human element, right? Like accept the fact that like you're not perfect, That's hard to do in spine surgery because if you're not perfect, people have really bad outcomes. And so it's pretty stress inducing for me. So I know that for me to stay balanced, there's certain things that help. So for me, it's like spending time with my kids and my wife, it's working out, it's playing golf. And so I arrange my schedule accordingly. I don't like call weeks. I know call week is going to be, last week was a call week or this week's call week. It's going to be pretty busy and I accept that. But when I'm not on call, I make sure, I get a workout in the morning. And if I don't, I try to get one out in the afternoon, but kind of in between cases or before I go home or after my kids go to bed. I try to play golf, once or twice a week. Just because being out there just, with kind of turn my phone off and it just allows me to sort of just kind of be in the environment and not stress and not worry about anything.
Yeah.
So I think you have to find, what essentially kind of centers you, So for me, it's that. It's sort of, like my wife and kids, golf, working out, reading and praying in the morning when I get up just to kind of start my day, with that. It's hard to have a bad day when you're centered, for me. And so that's why I sort of like to get up, kind of get a little reading and praying in, get a workout in. And I feel like, I'm kind of ready to sort of take on whatever comes.
What a great place to be for golf, huh?
Oh, yeah. It's nice.
That's awesome. So it sounds like even if you might not have all the time in the world, you kind of capitalize on it by increasing the quality of what you do. Since you don't have the quantity of time, you really like focus on what's filling my basket.
For sure.
That's awesome. Okay, so one last question before I get to the meat and potatoes.
Okay.
Have you ever experienced any moments in your career where you questioned your choice to become an orthopedic surgeon? And if so, how did you overcome those doubts?
Yeah, so it was second year medical school for me. Sorry, second year residency for me. Wow. Yeah, so medical school, it was challenging, but all I had to do was study. And so I thought the information was really cool. I had good study partners, and we kind of enjoyed the process. And so even though it was challenging, it wasn't necessarily stressful, right? Because I sort of feel like, my expectations, like I didn't expect to be here. Like my grades in college were pretty good, but not amazing,
Well, that's inspiring.
Yeah. So
I don't need to be perfect to become an orthopedic surgeon.
So my dad, it was funny. We were having conversations and my dad was trying to get me, my dad's a pharmacist, he knows some pharmacy students or schools in Nigeria. He was trying to get me set up to go to school there because he was pretty convinced I wouldn't get in here. He's just trying to look out for me,
Yeah, of course.
And so I remember when I got into medical school, it was hilarious. So I got into Indiana. I called my mom. I'm like, Mom, I'm in medical school. She was so excited. They were so excited. She called me back and said, "Now, are you sure this is not a master's program? Are you sure it's medical school?" I'm like, "Yeah, it's medical school, Mama." It was so funny.
I love that.
Right. And so I felt like medical school was kind of all lanyard. Like I wasn't expected to be there. And so then once I got to residency, right? So residency begins and I got into my first choice. I did a military residency.
That's so awesome.
Yeah, so I went out to Madigan, which Madigan, it's that area in of the country in Seattle. It's gorgeous. That hospital looked out at what mountain was it? Mount Rainier. Oh, cool. And so looked out at Mount Rainier from every view.
Oh, cool.
You walked by from essentially the surgical ward to like the clinic space, and they had this beautiful fountain with 2 doves. It was amazing.
Wow. What a dream.
Right. And so I got there and I felt like the expectations kind of changed, because all of a sudden, I'm like a first round draft pick to them. Yeah. So I need to perform. And so intern year wasn't that stressful because you're not really expected to know anything. But once second year came, it was completely different and the expectations changed. And I kind of, I'm a little older, right? And so the way we teach and educate residents and fellows now is very different than when I was in school or when I was in residency.
What do you mean?
Meaning like, it was just a little bit more malignant.
Okay.
It was malignant, It just was. That's just kind of what it was, because that's what surgeons thought they needed. That's how they thought they needed to train, individuals, because the goal was really, to get you to perform under stress, right? And that way, when you're in an operating room and you're in a stressful environment, you'll still be able to perform and you won't kind of freeze up. But it didn't feel like that when you were going through it. It just felt horrible.
Yeah,
you know,
I
I remember, man, like they would throw bananas at you. They would toss chairs.
What?
Yes.
Sounds like hazing.
It was terrible.
That's madness.
So I would get super sweaty. You know, I would have to change my shirt after the morning report.
Oh no.
One of my good friends who was a year above me, he would take a beta blocker ahead of time.
Oh my gosh.
Just to calm down. You know, so like now, like for example, like when my residents present stuff that came in from the morning, they're sitting down. You know, they're kind of up there. They have their notes. They're scrolling through the images. That's not how it was for me, you know, and plus I was in the military.
Yeah.
I had to have on clean scrubs, white coat. You're standing there at attention.
Wow.
And you're presenting everything from memory, patient name, information, what the imaging shows. And then when it came to like your plan and like what the patient needed, you had to have, so the first few months, you can read the typical book chapters that we have, like skeletal trauma, Rockwood and Green. After that period of time, you had to have read whatever articles, you know, came in, right? And so, and also we talk about the 80-hour work week now, like which is kind of a big thing. It sort of began at that time for me, but it wasn't a thing. Like I remember there were times where, you know, I would in residency, you know, I get up at 3:30 to study a little bit before I would round. Then I work that day, so I have clinic that day or OR that day. I'm on call that night. I'm up all day, don't sleep. Next day I'm in clinic or the OR, and then at night we have journal club where I'm presenting an article, and then I'm trying to get home, and I'm like, you're just so delirious,
like 3 days straight.
Yeah,
that can't be healthy for you guys or the patients.
Right, I don't think it is. So the way we have it set up now is better. Like it's okay to miss those cases, go home and get some rest for sure. But yeah, that period of time was just so stressful because I was just like, if this is what it's like to be an orthopedic surgeon, maybe it's not for me because nothing about this feels good. Not happy. I'm sad.
No, I bet. Bananas coming at you.
Right.
Like, that's
bananas
crazy.
coming, yogurt's coming, you know, chairs are being thrown.
Oh
and
God.
like, you know, and like my mentor, he's definitely calmed down from the way he used to educate people, but he was one of them, you know, so he and then his classmates were there. And like, at that point for me, like they're just very intimidating individuals. And so you're kind of terrified, you know, It's like that, you know, you want to, not only are you afraid, but you also want to perform well for them, you know, because you know they believe in you, want to impress them. And so that period of time was like super stressful.
No, I feel like for me, it's hard to perform like maximally when I'm stressed.
Yeah.
Like if someone's yelling over my shoulder, like I'm not going to learn as quickly
Right.
as if someone's like, okay, so this is what you got to do, you know?
Exactly. But like if you didn't perform well, it was worse.
Then it's bananas.
Yeah, it's bananas and yogurt. And so, yeah, like it, you know, that period of time was rough. That first probably 3 or 4 months was pretty rough. But then after that, it just kind of calmed down. I kind of got my own footing. I just realized what worked for me. You know, I needed to, you know, I started reading more. And so I realized that like ultimately what gives me anxiety in those moments were the fact that maybe, you know, they're going to ask me something that I don't know, you know? And so then I realized, okay, well, if I know everything, then there's nothing they can ask me that I won't know. Okay. And so that's just what I did. I realized I probably in residency on average as an R3 slept, you know, 3.5 to 4.5 hours a day. I would take a nap at some point when I got home, you know, 30-minute nap. But then I would just read, and I read everything. I read, you know, cover to cover, Rockwood and Green, skeletal trauma. I would read them back and forth. I would read, you know, whatever articles I can find on that topic. Yeah. And so I just kind of kept building on this knowledge base. And so by the time, you know, January hit of my R2 year, I felt like there wasn't a question that they could ask me that I would get nervous about. And so then it was easy. I just had to kind of maintain that, but then it kind of got a little easier.
Okay, so you overcame the doubts by like just rising to the challenge, by just really like, okay, how am I going to get through this?
Yeah, like I think whenever you feel challenged or stressed, right? Like you have to be able to check in with yourself and figure out the why, right? So for me, the why was, well, I'm stressed because I feel like they're going to throw a banana at me. It's going to make me feel embarrassed. They're going to ask me questions I don't know, and then they're going to make it seem like I should know, and I'm going to be embarrassed. So it's like, well, if there's nothing that they can ask me that I don't know, then I won't feel that way. And that's kind of what it was.
Okay. No, that's good advice. I feel like reading is kind of like under, what's the word? Like people are so about Anki these days.
Yeah.
But I've gotten advice from mentors where they're like, you need to read stuff. Like if you read, you'll pick stuff up more.
Yeah.
So yeah. So Dr. Agochukwu, people visit you in some of the most vulnerable, dire, painful, uncomfortable states of their life. They're looking for you for hope, healing, answers. And I'm sure it's tough. What would you say are some of the most impactful patient cases of your career, whether that be in the difficulty of diagnosis, the emotional context, or just the patient's ultimate outcome?
So I would tell you that, like, for me, it's interesting. Like, when I'm doing cases, when I'm diagnosing patients in clinic, there's this little something in my head. I don't know what it is. I don't know if it's the Holy Spirit or what it is, but like something tells me that, like, you should do this. I'm thinking this, you should do this. And so I always try to listen to that voice. I had an attending, his name was Eric Putler, who would always tell me, like, listen, when people come to you or when you get consulted by a different service of orthopedics, or in this case, spine surgery, they have a question. So you need to seek disease. And so I remember there was a time where, there was a case of a guy who got shot in the back, right? A gunshot wound, lost all sensation into his legs and couldn't move his legs. Okay. And typically what we usually say is, the reason people have those symptoms are because of the concussive effect of the gunshot wound, right? So when you get shot, essentially you can have symptoms for a number of reasons, right? So what impacts those symptoms are the type of gun. So if it's kind of a low velocity versus high velocity weapon, if it's what range is it, close range or distance, what type of bullet is it? Because they all have different effects in terms of essentially the injury, right? You can kind of have like a permanent cavity where there's injury and cell death, and that doesn't change, and you can have sort of a temporary area, which we call kind of a temporary cavity, where there's some injury, but a lot of that tissue is kind of viable, okay, right? And so with gunshot wound, we think that it's secondary to concussive injury. We don't know if it's kind of a permanent thing or long term or short term thing in terms of being primary cavity or temporary. But ultimately, typically surgery doesn't really work for gunshot wounds in and around the spine. The reason being is that it causes a lot of local destruction. Typically, if you try to get in there, there's not the covering of the nerves. The dura is typically kind of shredded apart. There's just nerves everywhere, and it doesn't really change the patient's overall outcome. Okay. So he had a gunshot wound, and they're like, oh, he doesn't have anything. I'm like, oh man, that kind of sucks. And I'm looking at his imaging. I go talk to him, and I go back and I'm like, man, like this seems a little bit different for whatever reason. I don't know why. I look, and so in the spine, the spine is kind of divided into what we call a functional spinal unit. So essentially it's a vertebral body, a disc, and a vertebral body. And in the back, you have joints in the spine, right? So you have these processes. So you have a superior and an inferior articular process coming off each segment. Mm-hmm. So the inferior articular facet of the one above and the supraarticular facet of the one below kind of make that facet joint. So essentially his had fractured in, but I couldn't really tell what was going on because the bullet was just kind of stuck within that area, within the foramen. The CT scan and all that, you can't really see what's going on because there's so much artifact from the bullet. But ultimately, I'm looking at it and I'm like, I think that gunshot wound, like it impacted that fragment, but it's causing cord compression. Like that's causing cord compression as opposed to him having some injury just from the concussive effect of the bullet. Mm-hmm. And so I was like, listen, these typically don't improve. You kind of, or they do, but surgery doesn't typically do anything for them.
Right.
But I was like, listen, based on your anatomy, what I think is going on, I think it's possible that fracture may just kind of be compressing on your cord. And so I think I should go in and take the bullet out and then get that and then decompress it. He's like, well, doc, whatever you want to do.
Yeah,
so I was like, okay.
Try anything at that point.
Exactly. The challenge, one of the reasons that you kind of avoid surgery is because if you get in there, you take down that bone or the lamina that covers the dura, and there's no dura there, now you kind of create a problem where they essentially get what we call a pseudomeningeal because you can't cover the dura. It's just cerebrospinal fluid everywhere, and it becomes a much bigger problem for it. That can get infected. They can get meningitis. But I was like, listen, I think I should do something. He's like, okay. So I went in there, and it was just kind of like I thought. Like this bullet had essentially fractured off that facet and part of the lamina and was causing a pretty aggressive cord compression.
Wow.
And so I decompressed him. He didn't have a durotomy or any injury to that dura. I closed him up, and I was like, listen, I don't know if you're going to get anything back, but I think, what I thought you were going to have in terms of that cord compression, we relieved it. So we'll kind of see how you do. And so I see him, 3 months later. And at that point, he had some sensation improvement. He was starting to kind of regain a little bit of motion in his feet. And then he came in at 6 months and was walking. Now, granted, he wasn't walking that great, but he was walking,
That's amazing.
And so for someone like him, when you talk about patients, post-operatively, there's so many things that kind of play into how they do, right? So he's a gentleman that didn't have insurance. So in terms of like rehab and things like that, he couldn't get it. And so he still has he's getting nerve function back, but in that process of nerve recovery, if you're not moving your joints and staying mobile, you get some contractures. And so he had some hip contractures, some knee contractures. But overall, he was kind of getting up and mobilizing and kind of getting around.
That's amazing.
And so that felt pretty cool.
No, that's incredible.
Yeah.
I mean, I feel like so many other people in your position would have been like, the odds of this, bringing you back, your sensation and stuff is so low that I'm not even going to try.
Exactly.
Were you nervous going into this surgery? Like, what if I'm wrong and like now I'm screwing this guy up more? Or, like,
no, I mean,
just like had that feeling where you're like,
right. I feel like it's interesting at this point. Like, I don't necessarily get nervous, honestly, anymore. I get more kind of excited,
That's
and
cool.
kind of like amped up. Like, what am I going to see? Is it going to be what I thought? Can I help?
Yeah.
So it's probably less nerves and more just kind of
excited.
Yeah, a little amped
So
up.
what would you have done, I guess, if like you went in and it wasn't what you thought? Would you just like close and be like, sorry?
Yeah, I would have. So if he had a durotomy and nerve roots were everywhere, then I would have tried to put some patches on and try to oversew it so that if he does develop what we call a pseudomeningeal, where like it's no longer within the confines of the dura, it stays contained kind of underneath the fascia.
Okay, so you had a plan.
I had a plan for sure. I had a plan.
Amazing. No, I know somebody in my life who was shot in the spine, and to this day they can't, move their legs. They can't feel or anything. And I think that's amazing that you went for it and you tried. I'm sure this person's situation was different, and
for sure. I would say I take care of a lot of patients with gunshot wounds, and most of them are that. Most of them don't improve. The gunshots. There's no fractures anywhere. There's nothing causing cord compression.
Yeah, that's lucky.
Yeah, but he was very lucky.
He's lucky,
and
some angels watching over him.
For sure.
How do you think this situation impacted you going forward as a physician?
One thing that I think I will say is that, especially kind of early on in your career, you haven't seen a lot. You've gone through residency, you've gone through fellowship, but ultimately you haven't seen everything. And you read textbooks, but they don't have all the answers. You read articles, they don't have all the answers, because a lot of these things kind of happen on a case-by-case basis. And sometimes it's hard to publish what someone just thinks, especially nowadays. And so what I do is I lean really heavily on mentorship. So my mentor, John Devine, like I was telling you, and then just mentors that I've met through education. So I teach for AO North America, AO Spine North America. And so you meet all these surgeons from around the country who have, this large, breadth of knowledge, and you kind of ask them questions, and we're doing talks together, and you kind of get their perspective on different things. And I think I realized that, I use all of that to kind of guide me versus, just based on what I think.
I think that's awesome.
Yeah.
I think before coming into med school, many of us as pre-meds and stuff, we did well in school and felt like we could just do it all on our own. And it wasn't until the application process where I kind of hit a wall where I also might not have had the best grades, and I was like, can I do this? And reached out to people and now have mentors. And I think that it's such an understated necessity.
huge.
Like you
It's
need
huge.
mentorship
You do. You
in
do.
this field, probably every stage of life, but especially in this, like I think that's such a good piece of advice. When did this case happen in your timeline of career? Was it like earlier on or recently?
This is probably like 2019, I think.
Cool. Yeah. That's incredible. Do you think that situation shaped you as a person, like just in your personal life and how you viewed life or anything?
Yeah, I mean, it did. I mean, I would say that like all those moments I think are I think all those moments let you realize how fragile life is, and how close you can be to something catastrophic, right? But ultimately, no matter how dire, right, like situations seem, it's not over until it's over, And so I think it definitely, gives me, courage to sort of move forward, despite, feeling like I'm at the, all the odds are stacked up against me, or this task, seems insurmountable, or I can't overcome this. I think, my work, and seeing how patients improve and change when it seems like everything was kind of stacked against them, it definitely, gives me, the strength to kind of keep moving despite that.
That is amazing. Do you think that this gave you any like skills and resiliency, or do you think that it kind of just added on the faith that you already had?
Yeah, I think it just added. It's interesting. Like, I feel like it definitely adds to that little voice in my head that tells me something's not right, something's awry. Mm-hmm. I have patients who come in all the time who it seems like it's coming from their back, but something doesn't seem right. You examine them. It's like, well, actually, I think it's your hip, or actually, I think it's your SI joint, or actually, I think it's this. And so it definitely helps me listen to that voice. There's been a couple times, I'll give you a couple examples. Yeah. So there was a time where this particular patient had like a disc herniation, had the similar symptoms as that first lady I was telling you about, spinal cord compression, myelopathy. Mm-hmm. I get in there, I do a corpectomy where I have to kind of take out the bone because the disc has herniated behind her body. I take out the bone and I'm like, okay, I don't see the disc. Maybe everything is gone. But that little voice was like, you just haven't found it yet. It's there. It's there. And so I'm like, okay. So I just kind of this nerve hook. So I kind of keep messing around. And all of a sudden I find this little rent in this, what I thought was her posterior longitudinal ligament was really just a capsule that the body had made around this disc.
Wow.
And so I incised through that, and there's this massive disc that comes out, and then the spinal cord decompresses. It was crazy. There was another time where I was doing a discectomy on a patient in a lumbar spine, just going and taking out a little disc that was causing nerve compression. Mm-hmm. And so you have to kind of take out a little bit of a bone. We call it a hemileminotomy, where you just take a little bit of bone so you can kind of identify the dura and nerve roots and move them out the way. So I'd done that. I saw the nerve root, so I moved it out the way, what I thought was nerve root. And so then I see this shiny structure. I'm thinking it's a disc. I'm like, okay, perfect. And that little voice was like, that's not the disc. I'm like, what do you mean I have a nerve root? And so they essentially sometimes patients have strange anatomy. And this patient just had their what we would call the traversing nerve root. It comes down and around, but their other nerve root had already come off. And so what I thought was a traversing nerve root was not. It was actually the exiting nerve root of the one below that one. And so I freed that nerve root up and brought it along as well. And then I was able to get the disc out. So there were two, when there should be one dura and one nerve, it was dura and two nerves.
Wow.
And so there's been little situations like that have happened, a fair amount, right? Like whether or not it's in surgery or whether I'm diagnosing patients, that happens where I'm like, this is definitely beyond, me,
Yeah.
I remember when I was in Atlanta, I was talking to a guy, he was like, man, like as a spine surgeon, right? Like when you operate on patients and you like get them back to that place, it must give you some sort of like a godlike complex. I'm like, no, man. Cause I know that it's not me, right? Like I'm grateful that I've, had the opportunity to train with some fantastic surgeons. And I feel like I've learned a lot along the way, but like, I honestly believe that God gets me out of a lot of trouble, and makes sure that like the majority of my patients do well and have good outcomes.
That's beautiful. I love how humble you are. I think that's really awesome I think it might be easy in your position to get that godlike complex. And I think it's awesome that you just attribute it all to your faith in your higher power and like recognize that like this is God working through you to help your fellow like brothers and sisters.
For sure.
I think that's awesome.
Yeah.
That's super cool. Dr. Agochukwu, thank you so much for sharing this experience with us. Your stories were super cool. I love how human you are, and very easy to talk to you. And I just had a great time in this interview. Thank you so much.
Thank you. I did too.
Okay, so before we wrap it up, though, I wanted to ask a couple questions that might help future med students or people currently in med school. So what is a piece of advice that you would give to a prospective medical student watching or listening right now?
So I would say a prospective medical student, like if you have an interest in medicine, push forward, find a mentor. You would be surprised how, open, physicians are to that. And it doesn't have to be a physician either. Just, someone who you trust, who can give you good advice. I think it's critical to find a mentor and just keep pushing, being sort of on the other side now and kind of working with admissions. You realize that, it also doesn't happen for everyone right away. Some people don't get it, if this is what they want to do, they may not get accepted right away. But if it's what you want to do, whatever you feel your application needed, to be better, to make you a more desirable candidate, for medical school, do that. Whether or not it's, get a master's, or you need more, research, or if you need more experiences in terms of shadowing or whatnot, do those things. But if that's your goal, don't give up on it, regardless of how difficult it may seem.
I agree. And I think mentorship is great to let you know what you're missing.
For sure.
Great piece of advice. So what is a piece of advice you would give for current med students who are wanting to stand out for residency?
So residency, I think, is becoming more and more challenging, right? Because step 1 is now pass fail, although step 2 is still scored. And so I think you have to do well on step 2, because I think that's still going to be utilized to kind of help figure out exactly based on what you want to do. But ultimately, I think the big thing is, number one, in terms of your application, right? Like it's going to require someone who's a little bit more well-rounded, so you can make yourself stand out that way, whether or not it's whatever you are passionate about or interested in, focus on those things, whether or not it's, community service, stuff like if you have a podcast, or if you're interested in, some sort of, video kind of recording, stuff like that. Like, I think seeing that people really identify with, if it's within your church and you like to do mission work, do that. And I think in terms of the application, that's what you want to see. Research is, I think, useful. Doesn't matter what kind of research it is, just something. So people understand that, like, you're interested in understand, how important really research is. That's kind of how we know that really drives patient outcomes. Understanding like new techniques and better ways to kind of help patients. So I think that's important. I think the other thing that's important is, once you're actually, kind of in your sub-I, when you're there, be present. It's not the time to, get your teeth checked or whatever else. Be there, be available. You want to be, have your voice heard, but not necessarily overpower anyone, especially when you're around the attendings and whatnot. Definitely understand that, like, your place is to communicate with the residents, and try to figure out, ways to kind of, make sure that you're not quiet, because you want people to know that you're there, right? But I think the biggest thing is when you're on an elective, work hard. Show up early, stay late. If there are ways where you feel like you can be helpful, like, for example, like if you're in the operating room, help the scrub tech, help hand instruments, help prep, help, get the patient position, all those things, help clean ahead. And if there's time between the kind of turnover, all those things are noticed by the attendings and the residents. And we all look favorably, upon those things.
Okay. That's a good piece of advice. I think that right now research is a really hot topic. So I wanted to ask, you said that the type of research you're doing doesn't matter as much as just getting in and contributing to like the field of medicine. How important is like number of authorship, like first author, third author? How important do you think that is versus just quantity of contribution?
I think it depends on where you go, and who you talk to. I think there's some, like if you want to go to a place that like is known to be research heavy, then quantity may matter more. If you want to go to a place where, you know, it's more operative heavy, then I don't think quantity matters and quality probably matters more. I think people just want to see that you're involved, and they understand that, like, as a medical student, it can be challenging to be a first author, unless, you know, you're take a year to do research and that's kind of all you're doing.
Yeah.
It can be challenging within the structure of medical school to like be a first author on a number of papers. I think as long as you're on the paper, I think we look at pretty favorably.
Okay, cool. Okay, so I guess that's all the questions I have. Thank you so much for your time. Unless you have any comments that you'd like to impart before we wrap up.
No,
anything that like you've said a lot. That's amazing. So please feel free to share what's in your heart and your mind.
No, you know, I think that like sometimes it can get, you know, there's so many things that go into play with practicing medicine now, right? Like insurance has changed a lot, right? I think the business of medicine has changed a lot. You will see, like, once you get out, that now, like, you know, it used to be a scenario where you were trying to decide between academics and private practice. Now it's, you know, academics, hospital employed, because these big hospital systems are sort of buying up private practices and hospitals. Private equity groups are getting involved in the process, and so you can get out and work for a private equity group. So I think that like it's easy to get lost in the business of medicine. I think that it's important to remember your why, you know, because if it's the business of medicine, I think that's why it's easy to get, not easy, but that's why there's so much burnout, you know, because we get so caught up in, you know, making money and you sort of lose track on, you know, what you value, you know. I think you should look at, you know, medicine as, for me, it's less of a job, right, and more of a profession. It's kind of what we do. You kind of help people, you take care of people, and so let that be the focus, and you know, everything else will come.
That's awesome. Yeah. Dr. Agochukwu, thank you so much.
Of course.
Thank you for sharing. Thank you for the stories. Thank you for the advice, and I really appreciate your time.
My pleasure.
Thank you so much for watching the Doctor's Debrief podcast. I hope you enjoyed the stories, lessons, and perspectives shared today. To make sure you don't miss an episode, make sure you subscribe to the NDMD YouTube channel or whatever streaming service you choose to listen on. And please don't forget to comment and like while you're at it. See you next time.